Hi, my name is Rebecca Govan, and I'm here to talk to you about the role of social work with people with fetal alcohol spectrum disorder, as that's my doctoral studies at the moment that I'm researching in. So really grateful to Cascade for this opportunity to speak to you on this subject. Just before I start, I understand that the conference that this is being included in focuses on learning disability. The complexities around the interaction between FASD and learning disability are way above my pay grade. So it's not something I'm going to go into today. It's not my specialism. It's not my area of research. However, if you did want to look at that interaction in more detail, there's an excellent fact sheet here from FASDnetwork.org that outlines the differences between learning difficulty, learning disability, and how they're experienced in very different ways by different people with FASD, it being a spectrum of needs. How that works out in different people's lives is multiple and complex, really. And then if you wanted a more academic exploration of that, there's this paper here exploring the complexity of intellectual disabilities in fetal alcohol spectrum disorders. So please do have a look at that if you want to know more about that particular a particular way of looking at FASD that I won't be going into detail on today. So what I will be doing today, starting off with this excellent piece of artwork here by Rossi, artwork by Rossi Griffin, who is a member of my research advisory board. Rossi was on Glow Up last year. He is a person with FASD who is enormously talented as a makeup artist. So I just wanted to start really with just a reminder and a focus as we talk about FASD of the strengths and the talents of people with FASD. So a real kind of strengths-based approach there, led by Rossi and his excellent piece of makeup there. So the content of today's presentation will be to talk a little bit about myself, a little bit about the context for my research, which is based on my initial literature review. As I don't have any findings as such, I haven't entered into my active research stage yet. I have, however, looked at a lot of initial literature from both the fields of adoption, social work, and also FASD. Looking at the links between social work practice with people with FASD in post-adoption social work support and potential implications for practice. So where are we at the moment in social work practice, and where could we be heading? Just kind of hypothesizing a bit about that, really. So that's me. My name's Rebecca Govan. I'm an assistant lecturer and doctoral researcher at Birmingham City University. There's our very lovely campus. I work for 1 day a week in the social work department, lecturing with fantastic colleagues. And I'm also a member of our social work research cluster. And it's a funded PhD. So I'm very lucky to have this opportunity, really. So more about me. Can't stop talking about myself, can I? I'm a social worker with adults, and I have been for nearly 20 years, which is ridiculous, really. 20 years next year. I've never practiced with children, so I appreciate that although my research is about social work with children and families, my practice, my frontline experience, management and project management experience, it has not been. So there is a difference there. I am an adopter. I have 2 biological children, and my 3rd child is adopted. She has a diagnosis now, only recently had a diagnosis of FASD. As I've said, this is the area that I'm studying. It's close to my heart. It means a lot to me, and that's what's kind of driven me in this research. I have the privilege of teaching up and coming social workers, and I hope to kind of impart to them a bit of my learning from practice, my career, and also my personal lived experience. As I said, I'm also a member of our SWEP research interest group. If you want to look at more talks that we've done, Social Work on the Edge was our series recently. My excellent colleagues have also done seminars there on that link alongside mine, which goes into a lot more detail of this literature review than I can provide in the time we have today. So, just to give you a bit of background, if you're not already aware, there is a high prevalence of children with FASD in the care experience population in the UK. Gregory did a piece of research in Peterborough in 2015 where they looked at children being put forward for adoption. In particular, 75% of those children were suspected or confirmed to have been exposed to alcohol in utero and have FASD. So that's a huge number, isn't it, really? So 3 out of 4 children put forward for adoption are highly likely to have needs related to FASD. So that means then that when we're working with children and families in post-adoption social work, it's highly likely that we will be working with children with FASD. And that then would lead to thinking about what are the training needs, what do we need to know, what works with these families and what doesn't. However, David Gilbert's study in 2021 with social workers in England really came up with the findings that there was a lack of policy and procedure and training in FASD for social workers in England. There isn't much in England regarding social work and FASD, but that's a recent study that's really worth looking at if you're more interested in this area. So this lack of research is evident, and that's what's kind of led to me wanting to fill that knowledge gap. So where are we at in practice at the moment? The literature that I've looked at really situates social work very much in the pregnancy of a woman who may be using alcohol in potential child protection arena, looking at having difficult conversations with that person and asking difficult questions. These are things that are well within the social work skill set. These are things that we do most days, really, in frontline practice, have difficult conversations and ask professionally curious and necessary questions. So that's one area that social work is often mentioned in. Another one that's kind of quite debated is whether social workers are adequately recording and assessing alcohol use in pregnancy. It would seem from the literature that we are assessing and recording drugs use in pregnancy, but not so much with alcohol use. And that can really impact on the future of that child and the experiences of their family post-adoption. Because if you don't have any recording in any professional documentation of alcohol use in pregnancy, that can make diagnosis even more difficult to get. There's lots of challenges and difficulties and hurdles to overcome with a diagnosis for FASD, and it isn't made any easier by not having those recordings. So that's something that is debated as to whether we're adequately doing so at the moment in social work in this area. And then thirdly, something that again is a real strength, I believe, in practice is giving people adequate information and advice. In this country, we have only in recent years really started going with the advice very clearly that there is no safe amount of alcohol in pregnancy, that you can't get away with any alcohol in pregnancy, really. That's been confusing in the past decade. I know that wasn't the advice I had in my first pregnancy. So lots of us have experienced different advice from midwives and health professionals. And really, it's whether social work can help to clarify that, help to seek out information for that family and that birth mother. So that's kind of where things are at the moment. Again, just touching on information and advice here, Aiton's saying that all professionals are involved, especially at that stage of pregnancy, to help women make autonomous decisions. But here's what's really interesting is where are we going? And I guess this is my kind of conjecture based on my initial review. Just to clarify, don't have findings pointing in this direction as yet. So I feel we have a role in all of these, and I'll go into some of them in more detail. Diagnosis, anti-discriminatory and anti-oppressive practice, a key kind of tenet of social work. Advocacy, again, a key skill that we teach our students at BCU and across England and the home nations. Caregiver support and empowerment, and social work education and training. So where are we going in all of those areas? Is there a place for social work in all of those areas? So the question is, what could FASD informed practice look like? Hopefully a little bit clearer than this misty wood that I'm walking in there. So the question is, do we have a role in diagnosis? As a specialist in working with older people in my frontline practice, I would always say that I have a role in their diagnostic processes, not based on the medical model of disability, but more towards the social model. Is what does that diagnosis do for that person? What support do they need around that? What information, advice, and education do they need around that? How can the MDT best help them with that? That process of grief and loss that often a diagnosis will bring with it, and obviously change that it brings with it for the better or the worse. So here's some quotes that are helpful regarding perhaps a role for social work and a place for diagnosis and the importance of that within FASD. Is here Mukherjee and Aiton talking about it helping the family to understand themselves and bringing clarity. And then there are supportive strategies, and more so that even since I've started researching last year in this area, of things that do work with children, families, and adults with FASD. So all of those things can help come out of a diagnosis, and we can be part of that as social workers. And from a public health perspective, this here from Oatley and Gibbs talks about the misdiagnosis or missed diagnosis that often happens with FASD. We know that co-diagnoses can often be autism and ADHD. That's absolutely in line with FASD a lot of the time. But to diagnose that instead of FASD is often the issue. This can lead to inaccurate data collection. So the bigger picture is that we then don't know the incidence and prevalence of FASD because people aren't getting diagnosed, and then we can't measure what we need to do about it. One of the biggest myths in this area is that this is a rare condition. It is not a rare condition. The recent Salford study would indicate that it is more prevalent than autism in this country. So we really need to recognise this and fully fund prevention and support efforts based on good kind of data, which we don't have at the moment. And then here it says from Catherick and Curran in 2014, social workers on the front line need to proactively recognise this disability and seek a diagnosis that can help this individual, the person with FASD, to navigate the complexity of their condition and their journey through life as that changes and twists and turns. So yes, the answer is I believe we do have a role in diagnosis, and therefore that lends itself to a role in helping that person find their identity as somebody with FASD. So caregivers report that they found the process of assessment and diagnosis validated those talents and strengths that I talked about when I referred to Rossi's artwork at the beginning of this talk, and also their needs. So it helped to clarify, and it also helps to lift the blame and shame of the caregivers feeling like they're constantly letting down their child, or they've just got a very naughty child who just can't behave themselves. It lifts all of that, and it gives them a much more positive take on identity. And then here, Hanlon Dearman saying that children who are going to be self-advocating for their treatment decisions and care will need to be aware of their diagnosis and understand their specific profile of strengths and challenges, which is different for everyone. So they need time to learn that and come to terms with that and use that helpfully in their own life. So here I've touched on it already. Anti-discriminatory and anti-oppressive practice, stigma, labelling, blame and shame are a recurring theme in this area, not just for birth mums, but also for families, for children, adults with FASD, for the caregivers, for adoptive parents. So Corrigan talks here again about the impact that stigma and that blame has on the bigger picture, that people aren't allocating in research the same amount of monies towards programs to support and prevent FASD in terms of support for birth mums and their children. These were significantly lower than funds allocated to all other programs. So they're saying that this could have been influenced by commissioners presuming that FASD applied to fewer people, as I've said, those prevalence estimates being completely wrong, really, in lots of cases, but also because they just don't see them as deserving. Because of the stigma, labelling and shame. So we as social workers can support to lift that by caregiver support and empowerment in particular. as I've said, by kind of lifting that feeling of being a failing parent, a failing caregiver, that can lead to adoption breakdown and or caregiver burnout. There, Catterick and Cohen allude to that. And just understanding that it's got to be a whole family and a holistic approach, really. Things that are affected here, Hannah and Dearman's talking about affect and state regulation, such as difficulty with very physical basic needs, feeding, sleep, tone, high-pitched vocalization, focus, attention, and difficulties with autonomic regulation. I know from our lives that my daughter didn't sleep properly for the past 10 days, and it's exhausting and it's very difficult to function and be regulated as a parent in that kind of a state. So we as social workers can really support caregivers and friends and family um, in terms of education and empowerment. And finally, moving on to the MDT and the role of the social workers here, I feel this is an interesting quote from Catterick and Co. The role of the social worker within this MDT is to keep a chronology of the child, make referrals, provide short breaks for carers for respite, and support transitions. And very often when I've looked at the literature here in this list from Catterick and Cohen, they do have social work in there, probably because Liam Cohen is a social worker. But very often in the literature, the MDT described around a person with FASD and their family does not include the social worker. And this quote really, I feel that the role of the social worker can be so much more than that, more holistic than that, more therapeutic, more supportive, and more challenging perhaps in that MDT around those issues of stigma, blame, shame, and assumptions that we all can make at times because we're human. So thanks so much for listening today. And please do get in touch, particularly if you've got an interest in this area. I'm always up for broadening my professional network. I'm new to research. So if you're a social worker who practices in a post-adoption or a parent carer, I'd really like to speak to you if you've got any interest whatsoever in this area of FASD and post-adoption social work. So there's my email and here are my references. Thank you.